Did you know that prostate cancer is one of the biggest health challenges men face? According to the American Cancer Society, it is the second most common type of cancer among men, behind only skin cancer. To get an idea of the severity, approximately 1 in 8 men will receive this diagnosis throughout their lives. Only in 2024, about 300,000 men in the United States were diagnosed for the first time, and more than 30,000 lost their lives for this disease. But here's the good news. When detected early, prostate cancer has a very high chance of successful treatment, drastically reducing the risk of fatality. That's why recognizing the first signs could be the difference between life and death. However, many men don't pay attention to your prostate until symptoms appear, and this can be a fatal error. This small gland, located just below the bladder and around the urethra, is essential for the production of seminal fluid, playing a fundamental role in male fertility. And unfortunately, prostate cancer can develop silently, without showing signs for years. Most cases of this disease are adenocarcinomas, that is, they arise from glandular cells. In terms of behavior, there are 2 main types. Fast-growing cancer. It advances aggressively and can quickly spread to other parts of the body, becoming extremely dangerous. Slow-growing cancer can remain unnoticed for years without apparent symptoms. Some men live for decades with this type of cancer without it affecting their quality of life. But the real danger arises when the disease spreads to other organs, making treatment much more complicated. That's why regular prostate exams are essential, even for those who feel perfectly healthy. Before we reveal the warning signs you cannot ignore, enjoy this video and subscribe to the channel. Here, we bring you valuable information to help you take better care of your health. Sign 1. Painful urination or burning sensation. Do you feel pain or a burning sensation when urinating? That it's not normal and may be one of the first warning signs of prostate cancer. As this gland grows due to cancer, it can block the natural flow of urine, causing discomfort and burning. But the problem can be even more serious. Prostate cancer can spread to nearby structures, such as the bladder, urethra, and even the rectum, further increasing the pain. Furthermore, when urine is retained for a long time due to this blockage, urinary infections can arise, intensifying the burning sensation. In some cases, antibiotics can temporarily alleviate discomfort, but if the problem is prostate cancer, appropriate treatment needs to be provided by a doctor. Some factors can increase the risk of this symptom, such as family history of prostate cancer, genetic factors, obesity and sedentary lifestyle, unhealthy lifestyle. If you have these symptoms, don't ignore it. An early diagnosis can make all the difference. Sign number 2, waking up several times to urinate, nocturia, and frequent urination. Have you ever noticed that wakes up several times during the night to go to the bathroom? If so, this could be an important alert for prostate problems. The frequent need to urinate, especially at night, nocturia, could be a sign that something is wrong. In addition to being frustrating, this constant interruption of sleep can leave you exhausted and without energy throughout the day. Many people think this is just a natural consequence of aging, but if you've noticed an increase in the frequency of bathroom visits, it's time to pay attention. One way to monitor this symptom is to keep a bladder diary, recording how many times you urinate throughout the day and night. If the frequency is high, talk to your doctor as soon as possible. Sign 3, blood in urine, a red alert. You can't ignore. Have you ever noticed blood in your urine? This could be a huge warning sign. This condition, known as hematuria, may indicate that prostate cancer is at a more advanced stage. But did you know that there are 2 types of hematuria? Microscopic hematuria. Blood can only be detected through a laboratory test. Macroscopic hematuria. Blood can be seen with the naked eye, leaving the urine reddish or pinkish in color. It is estimated that between 3% and 5% of men with prostate cancer experience this symptom. It can occur when cancer invades parts of the urinary system, such as the kidneys and bladder. If you notice any change in the color of your urine, don't ignore it. Seeing a doctor right away can be the key to an early diagnosis. Regular urine tests and a complete checkup are essential to detect the problem before it worsens. Sign 4. Persistent back, hip, or leg pain. If you feel unexplained pain in your lower back, hips, or legs, pay attention. It could be more than just tiredness or physical exhaustion. Prostate cancer can spread to the bones, causing deep, persistent pain in these areas. And here's a sobering fact. Men who report unexplained back pain are more likely to be diagnosed with advanced prostate cancer. In more serious stages, this spread can cause weakness in the lower limbs, numbness or tingling sensation, pain that does not improve with time. If you have any recurring pain without a clear explanation, don't ignore it. Make an appointment with your doctor as soon as possible, as early detection can make all the difference. Sign 5. Sudden weight loss. A warning. You can't ignore. Are you losing weight without dieting or changing your exercise routine? If the numbers on the scale are dropping without explanation, this could be a worrying sign. Unexplained weight loss can be a silent indicator of several types of cancer, including prostate cancer. But why does this happen? Cancer cells consume the body's energy, interfering with metabolism and causing side effects such as extreme fatigue, changes in appetite, frequent nausea. Many men ignore this change and even think it is a positive surprise. But don't be fooled. Your body may be fighting an invisible battle, and spotting the cause early can make all the difference. If you are losing weight for no apparent reason, see a doctor immediately for a detailed evaluation. Sign 6. Pain in the rectum. A discomfort that can be a serious sign. Have you been experiencing pain in the rectum or discomfort when having a bowel movement? This may not just be a common digestive problem. If prostate cancer spreads to this region, it can cause constant pain in the rectum, frequent constipation or diarrhea, urinary urgency and incontinence, gas and feeling of bloating, partial intestinal blockage. These symptoms should not be ignored. Seeing a doctor for specific exams, such as digital rectal examination, ultrasound, and PSA tests, can help identify the cause and ensure an early diagnosis. If you notice changes in your bowel pattern or persistent pain in the region, don't wait to seek help. Sign 7. Pain when sitting. A warning. Many people ignore. Is sitting for a long time becoming uncomfortable or even painful? If you experience pain when sitting, especially on hard surfaces, it could be a sign of advanced prostate cancer. When the prostate enlarges due to cancer, it puts pressure on surrounding nerves and tissues, causing pain in the pelvic and lumbar region, discomfort in the perianal area, feeling of numbness in the lower part of the body. This symptom can progressively worsen, affecting your quality of life. If you feel any discomfort when sitting, don't ignore it. This could be a sign that something serious is happening. Consulting a healthcare professional for detailed examinations can prevent complications and ensure an early diagnosis. The sooner it is identified, the greater the chances of successful treatment. Here's a significantly more engaging, easy to understand, and relatable version of your text without shortening the content. Sign 8. Trouble urinating. When the simple act of urinating becomes a challenge. Having trouble starting or maintaining a steady flow of urine? This situation can be more than a simple nuisance. Prostate cancer can cause urinary retention, making completely emptying the bladder a difficult task. This occurs due to tumor invasion or enlargement of the prostate gland, which compresses the urethra and prevents the normal flow of urine. Don't ignore this symptom. Seeing a urologist immediately can help identify the cause and begin appropriate treatment. Remember, acting early makes all the difference. Sign 9. Loss of bladder control. When holding urine becomes impossible. Do you have trouble holding your urine or experience unexpected leaks? Urinary incontinence can be a warning sign of prostate cancer or a consequence of treatments such as radiotherapy or prostatectomy. The prostate plays a crucial role in controlling urine flow. When affected by surgery or the cancer itself, the nerves that help control the bladder can become damaged, resulting in loss of control. It is estimated that up to 25% of men face some degree of bladder control problems after treatment for prostate cancer. Don't let discomfort or embarrassment stop you from seeking help. Consulting a healthcare professional can provide the relief you need and improve your quality of life. Sign 10. Painful ejaculation. When intimacy turns into discomfort. Intimacy should be pleasurable, but feeling pain when ejaculating is a clear sign that something is not right. Painful ejaculation can range from a sharp pain in the penis to a dull ache in the testicles, or even an uncomfortable throbbing in the rectum or lower abdomen. While some men experience only mild discomfort, others suffer from intense and persistent pain, which can profoundly impact their sexual and emotional life. This pain should not be ignored as it may indicate serious prostate problems, including cancer. If the pain when ejaculating persists, do not delay consulting a healthcare professional. Early detection and appropriate treatment can prevent more serious complications and restore pleasure to your intimate life. What do we really know about prostate cancer? Experts still don't have a definitive answer about what exactly causes prostate cells to become cancerous. But here's what we know. Just like any other type of cancer, prostate cancer begins when abnormal cells begin to multiply rapidly and uncontrollably. Instead of following the natural cycle of cell growth and death, these cells continue to reproduce without stopping. Over time, they accumulate and form a tumor, which can grow inside the prostate and eventually spread to other parts of the body, a dangerous process called metastasis. But here it is the good news. In most cases, prostate cancer grows slowly. Doctors often detect the tumor before it spreads. If diagnosed early, there are several highly effective treatment options. This means that when prostate cancer is discovered early, the chances of overcoming it are very high. Main risk factors for prostate cancer. Although any man can develop prostate cancer, some factors significantly increase the risk. Here are the 4 most important ones. 1. Age. The risk increases over time and becomes much more common after age 50. 2. Family history. If you have one close relative, if you have had prostate cancer, your chance of developing it is 2 to 3 times larger. 3. Obesity. Being overweight can increase the chances of developing more aggressive prostate cancer, in addition to increase the risk of recurrence after treatment. 4. Ethnicity. Studies show that African American men has a higher rate of the disease, and 1 in 6 will be diagnosed throughout life. How to reduce the risk of prostate cancer. Although there is no guaranteed form of prevention, some lifestyle changes can significantly reduce the risk. Here are 5 proven strategies. 1. Maintain a healthy diet. Prefer fruits, vegetables, and whole grains, reducing the consumption of processed meats and ultra-processed foods. 2. Skip the supplements. There is no scientific evidence that vitamin supplements reduce the risk of prostate cancer. The best option is to get the nutrients directly from food. 3. Exercise regularly. Just 3 days a week of physical activity already helps improve overall health and emotional well-being. 4. Maintain a healthy weight. If necessary, lose weight gradually through a balanced diet and regular exercise. 5. Talk to your doctor. Discuss your risk factors and see if preventive treatments, such as medications, finasteride or dutasteride, may be an option. But remember, any medicine has side effects, so consult a professional before making any decisions. Most important, don't panic, but don't ignore the signs. Prostate cancer is highly treatable, especially when diagnosed early. If you notice any of the symptoms we mentioned, don't assume the worst. Just contact your doctor for proper assessment. If you found this information helpful, like this video, subscribe to the channel and share with others who may benefit. And don't forget to leave your comment below. We want to know your opinion and experience on this important topic. See you in the next video.